Thank you guys for doing this, Doctor. I think this question is for you. As a result of this outbreak, there has been the expression of real concern in the gay community, the LGBTQ plus community, about a stigmatization specifically related to gay men. So what specifically can you say as it relates to those concerns of a new stigma being attached to gay men across this country due to monkeypox?
So I'll start by saying it's the role of governmental public health and government to really model excellent behavior on that. And I think we're really proud of the work that we've done to create non-stigmatizing language to inform people what they need to do to stay healthy. So I think that that's the first step, which is really making sure that we're modeling the right behavior and that we're putting out materials that speak to the community in a way that doesn't stigmatize them. I think it's all of our responsibility, and I think that we as sort of the role model in that, it's really important. But I think that, in media, in the way that we communicate with our students and universities, in the ways that we communicate with others that need to know about this, really making it clear that this is a virus. It's, like I'd like to say, a piece of DNA wrapped in some fat. It's not smart. It can't distinguish between people based on their sexual orientation or gender. And so everyone needs to be aware, but we need to make sure that we're messaging appropriately to the folks who are overly represented in the outbreak.
And to be clear, though, for those who are sort of embracing this stigmatization, right? This is, as we've witnessed in other diseases of impact, in particular the gay community, this is not by a handshake, this is not by going into a restroom. Can you help clarify some of the confusion that exists, the misperceptions?
Yeah, so I think, this virus transmits through very close skin-to-skin physical contact, often in the setting of sexual exposure. But there are other mechanisms for its transmission, including if you touch objects that individuals who've had monkeypox touch, or if you have prolonged exposure to respiratory droplets. With that said, signaling to people who are in the gay, bisexual, other men who have sex with men communities, and also transgender people who have sex with men, that it's really important to have awareness that it's circulating in the community is really a critical part of the messaging, while not generating inordinate concern and really focusing on the infection as linked to an identity. So it's just an infection, it's not linked to an identity, it just happens to be in the social network.
Thank you, sir. I do want to dig deeper into the racial disparity because it's growing week by week. Fewer and fewer cases are being seen among white people, more among people of color. I think it's something close to 75% now. You mentioned it's a priority. What specifically are you doing to reach out to people of color?
No, it's great. I think that the core work that we've done to reach out to people of color really begins with the fact that we've made vaccine accessible. So the first step in addressing a lot of the equity issues and gaps that we see in vaccination is really about making vaccine available. That means the new strategy, the intradermal strategy, making sure we have more vaccine, all of the work to create more vaccine to bring to the U.S. as well as to fill and finish in the U.S. has been really important. But we also have all of these equity interventions that include these large events. I think Bob just told you about a couple of really large ones that have been, frankly, wildly successful with thousands of vaccines that went to the community. We've also gotten vaccines to community health centers as well as to Ryan White sites that really serve this population. So the low-hanging fruit is done. The folks who are early adopters for this vaccine have gotten it, and now we're really on to the next level, which is making sure that everyone who needs it gets it.